So anyone considering photodynamic therapy must have a skin check, and that's because we don't want to miss melanoma. This is not a treatment for melanoma. So anyone who's got moderate to severe sun damage, you need to make sure they don't have any active skin cancers, in particular melanomas. So they can either have a skin check with me if they're in Sydney, or in Perth or Brisbane. We recommend they actually have a skin cancer check with the Skin Cancer Clinic before they have PDT. So we pre-treat all the clients with a program of Smooth Skin 8% and sunscreen in the morning, and Steva A and Clear Skin 2% at night. And we would recommend that they stay on this program long term after their treatment to maintain their beautiful rejuvenated skin. The pre-treatment helps normalise, stabilise and stratify the skin, and helps increase the penetration of the 5-ALA spray. If a patient is prone to cold sores, they need to take oral Zavirax or Famvir for 5 days prior to the treatment. This is to avoid developing a cold sore as their skin's healing. So on treatment day, the client takes an antihistamine and some analgesia. The antihistamine can be Telfast, Claritine or Zytec, and they take one a day for 5 days after the treatment. So they need to come in with a hat, sunglasses, long sleeve shirt or pants according to the area being treated. The patient needs to stay out of the sun for 2 days post-treatment. So for 24 to 48 hours after we paint the photosensitizing spray onto the skin, the patient will be photosensitive. And during that time they need to stay out of direct sunlight and stay away from bright household lighting. So on the treatment day they arrive without makeup, if their face is going to be treated, and obviously if it's hands or chest, those areas nice and clean. So we cleanse the skin, and I like to do a final alcohol rub just to get any residual oil off the skin, and then we paint 2 coats of 5-ALA onto the skin, and we want an incubation period of 5 to 7 hours. So the protocol that I'm following at the moment is I get the clients in at about 10 o'clock in the morning, we paint the area, they go away and hang out somewhere, not in sunlight, so they can go to a shopping mall, they can go to the movies, they can go home, and then bring them back in the late afternoon, early evening. And remember, they will be photosensitive when they're coming back in, so preferably when it's starting to get dark is the ideal time to bring them back into the clinic. They then go under the light, and they stay under the light, first the blue light, then the red light, and then they're ready to go home. By the time they wake up the next morning, they've really already done 24 of their 48 hours of sun sensitivity, so they've only got to really spend one more day at home. So after the incubation, the treatment area is washed with warm water prior to illumination. The clients put their goggles on, the area is illuminated with blue light for 10 minutes, followed by red light for 10 minutes. Now, blue light is the best light to activate 5-ALA. Some clients just can't handle blue light, it's too painful, in which case we just pop them under the red light. Now this is probably other than staying out of the sun for 2 days, the trickiest part of the whole process, because we do need to get that photosensitization reaction happening in the cells, and to get that reaction we need to get them to tolerate being under the light for at least 10 minutes. Now, if we use a Zimmer during illumination, that will definitely help to get them through that 10-minute period. I usually stay with them the whole time, talk to them, ask them how they're feeling. It's often a lot easier to experience something painful when someone's with you than if you're alone. So never leave a client alone under the light, because they will be in pain. You want to be there with them with the Zimmer, chatting them through the whole process, counting down the minutes. They want to do this as much as we want them to, and I find using that type of technique, I can get most people through the 10 minutes under the blue, and then a further 10 minutes under the red is actually quite bearable. So after completion of both the blue and red cycle, the client may continue cooling the treatment area with the blower until their skin feels comfortable. So it's a very similar process to what we do with Pixel. The client may then apply vitamin E oil or bio oil to the treatment area once the heat has subsided. So after illumination, the client will be photosensitive for the next 24 to 48 hours. Now the great thing about photosensitivity is that it's a self-checking process. In other words, they know they're still photosensitive, as they will feel burning in their skin if they go near a bright window. So again, you talk them through that process. You say that, if your skin's feeling like it's burning, it's because you're being exposed to light. It may even be halogen light is making you feel sun sensitive. If you're very, very, very light sensitive, then you can be in a darkened room. The most important thing is that they need to be warned that they will get a reaction. The whole idea of doing this treatment is to get a reaction in the skin. Now this reaction varies from a mild sunburn reaction to full blistering, swelling and scabbing. The degree of reaction will be in direct proportion to the amount of sun damage in their skin. So the more sun damage they are, the more the reaction that they'll get. And again, depending on the degree of reaction they get, will determine the healing time, which can be anything from 7 to 14 days. PDT can be repeated as necessary to control the appearance of new skin lesions. So most people, we would recommend that they will need between 1 and 3 treatments to get the optimum result. As PDT is a very intense process, I recommend doing the first treatments on the hands or the chest so that they can experience the whole process and the degree of reaction their skin has, without the added anxiety of it involving their face. As you know, anything involving your face, people get much more anxious than doing stuff to their body. And all my clients have agreed they were very glad they tried it on their hands or their chests first, that they wouldn't have liked it to have gone through and not known what to expect if it had been their face. So here's their checklist. They take their antihistamine tablet the morning before treatment and 1 per day for 4 to 5 days after treatment. That will in fact help with swelling. No makeup, sunscreen or any other product on the area to be treated on the day. Wash the area thoroughly before coming into the clinic, and remember to bring protective clothing, hat, sunglasses, gloves, long sleeve shirts and pants, because remember, coming back into the clinic, they will be sun sensitive or light sensitive. So they need to organise their life to stay indoors for 2 days after treatment. They can stay at the clinic for their full treatment, but they need to bring a book or a magazine or some paperwork so they've got something to do while they're waiting that 5 to 7 hours. We recommend they don't exercise for 5 days post-treatment and that they avoid direct sun exposure or bright light. If they have any concerns at all, they need to contact the clinic. So post-treatment information: when your treatment's finished, your skin will feel hot and sunburnt. They can apply the cold air blower until the skin feels comfortable. Go straight home, avoid excess sun. Whilst at home, stay in darkened areas, avoid bright house lighting and sun exposure for the next 24 to 48 hours. Ideally, don't go outside for 2 days. Good idea to keep a jug of cold water in the fridge and ice cubes. You can use cold packs to relieve heat in the skin. Panadol, Nurofen, even Panadine Forte's fine. Good idea to use air conditioning or a pedestal fan to ease the heat. Hot showers is required, and then we do a follow-up appointment 3 to 4 weeks post-treatment. And again, any concerns, they contact the clinic.